Neck problems impact millions, and if you're one of them, you want to watch this video in its entirety. Neck issues often present or start with muscular problems. If that goes long enough, it impacts joints, and as it progresses, it leads to spinal disc issues. Common spinal disc issues are those known as a disc bulge, a disc protrusion, a disc herniations. I'm sure some of you may have heard them. Other terms for them include slip discs. These are all descriptive terms. But what I want you to gather from this video is that it often starts as a muscular problem. In this video, I will cover the muscular origins of a neck issue, and then closer to the end of the video, if you still are around, you will learn some simple things that you can do at home with the help of a friend or a significant other to help you relieve some of that symptom as you wait before you go and visit your healthcare provider. Now, back to the muscles. Let me put this down. I will use my friend George here to explain certain things, starting with the muscles. As mentioned, there are muscles in front of the neck, and these muscles connect everything that you see. Let me move to the side, from here down here. These are the muscles that allow you to tilt your head and neck forward. Let me rotate, George. There are muscles on the side, from here to the shoulders. And then there are muscles at the back of the neck. And these are the ones that we're going to concentrate. Specifically, the trapezius muscle. It's a muscle that starts at the base of the skull, goes all the way down to the rib cage, below the rib cage, I should say. And the rhomboids that connect the shoulder blades. Now, the trapezius muscles are perhaps the most important of all of them. They're all important. It's not that one is more critical than the other. And in this video, I'm presenting trapezius as an important muscle because at the end of the video, I will show you things that you can do at home to help loosen some of that tightness. Let's say you turn your head and neck to the left. Oh, sorry, this is to the right. When you turn your head and neck to the right side, discomfort could be on this side, or it could be on the right side. When you turn to the right, and if you experience any discomfort on the same side you're turning to, it could be a joint involvement. Yes, a joint involvement can happen simultaneous to a muscle problem or as some progression of a muscle problem that now is impacting the joint. Another movement that you need to make is tilting your head and neck up and down. If you tilt your head and neck up and down and you sense discomfort, specifically in the upper back or at one of the shoulder blades, that usually means either a joint or a disc involvement. Now, going back to the movements, when you turn to the right and when you turn to the left, they should be equal in both directions. Yes, your range of movements should be balanced. If you have restrictions on one side versus the other side, it could be muscular or joint involvements. Now, if you stick around in a moment, I will go over some 2 to 3 manual techniques that you or a friend with you can do to help decrease some of the symptoms. But before I go there, let me move George out of the way so I can explain some more things for you. When you're on YouTube, you will see a lot of videos that practitioners, be it chiropractors, physiotherapists, masseuses, would talk about things that you can do at home to help your neck feel better. Now, some of these videos I have seen and I have disliked. Not that they're bad, but they should not be advising everyone to do those things. Because everything in the neck, whether it is a joint problem, a nerve problem, a disc problem, all of them at times feel as though they are muscular. And oftentimes, patients will say, I feel like a pulling sensation in my neck. Yes, that feeling could be distracting you from the actual cause. We'll go over trigger points that you can incorporate. However, whatever I show you do not do them until you have shown it to your physician, to your doctor, to your healthcare provider. Now, I'm going to move to the front so I can show you what you need to do. We are going to only concentrate on the muscles here. These are the trapezius muscle fibers that run this way, and on the rhomboids that connect the shoulder blades here, not close to the spine or the spinal processes, somewhere between the shoulder blade and there, but gently. And you want to relieve these, especially if you're sitting at the desk all day on your laptop or you're looking down on your cell phone. These get strained, pulled, stressed, trigger points, myofascial points, and all of which can be released. First, let's start with the trapezius muscle. What I'm going to do is I'm going to apply a gentle amount of pressure. Is that uncomfortable? And I'm going to hold it there for a few seconds. At the same time, I can do slight circular movements. This will help break down some adhesions in those fibers. And this, of course, is done without having the person tilting their head and neck, just looking straight ahead. But care must be taken to make sure that you're not going from this point forward. In other words, you don't want to do manual therapy on the muscles in front of the shoulder or past the top of the shoulders here. There are critical tissues there, the artery, the vein, the nerve, the brachial plexus, and I don't want you to be anywhere near it. Small circular movements. You can use your finger, little knuckle, not too much pressure, 3 to 4 seconds, move away to the next point, move away. And sometimes you can just hold it. That is enough to release that muscle. Yes, you don't need a lot of pressure. You don't need deep tissue massage. Just a little bit of stimulation onto the muscles and the nerves that control that muscle. You hold it for 2 to 3 seconds as the patient is fully relaxed, and you move to the next point. Once you've finished everything with the trapezius muscles at the top of the shoulder here, you can continue onto the shoulder blade, similar methods, and then comes the rhomboids. Feel around the bony parts. You can have the person bring their hand on top of the opposite shoulder. That stretches the rhomboids muscles a bit more and makes it easier for you to identify the edge of the shoulder blade, because you don't want to press on the shoulder blade, which is right here, because that's a very, very sensitive point. You want to be on the muscle. But keep in mind, there are ribs here, so you don't want to go too deep. Again, very gentle pressure. Very gentle pressure. You go up and down. Here, we went circular. Here, we go up and down, because these muscle fibers run this way. Up and down. I'm going fast, so to save you time, but ideally, I would say for about 5 to 10 seconds each point. But while you do it, it has to be comfortable. You can move. As you can see, I have my other hand at the edge of her shoulder blade, the scapula, so I know where that border is, and I don't want to get close to that because it'll be uncomfortable for her. So get the upper fibers, and I move down, get to the lower fibers, middle fibers, all of these fibers, and keep working all of these. And this should actually feel very soothing for her. And you do the same on to the opposite side. And I hope that will help alleviate some of the discomfort that you're feeling. And you have to be very, very careful. You don't want it to be too deep. You don't want to be punishing the person that you're doing this for. You want to stay gentle. It should be a pleasant experience. It should not be uncomfortable. Trigger points, your facial work, should never be uncomfortable, because if you're uncomfortable, what are you going to do? You're going to tense up. Counteracting the very efforts that you're putting into it. So the person that you do this on must be in a relaxed state. If they're relaxed, they will benefit more. So you have to make sure you do not press deep. The good point about not going too deep is that you will not damage tissues beneath the muscle or beneath the skin. Our skin and our muscles are packed with nerves and vessels. Some of these nerves are microscopic, as are some of the capillaries. Too much pressure can damage them. So care must be taken. That it has to be applied very light, especially when you're doing this for a younger person, for an older person, or for anyone in general. All right, it's time to show you the exercises I promised. Now, unlike others, I will not show exercises that are too aggressive. I will show you the gentle exercises that I believe will not be harmful for you. Even though these may not harm you, you still need to have it checked out by your doctor, by your healthcare provider, to make sure they're right for you. I have Marcus here with me. He is going to help me show and demonstrate these exercises. The first set of exercises that I will go over with you is the W, T, and L exercises. And here's how you do them. So what I want all of you to do when you have these exercises appropriated for you is to get your arms in the W position. Now, many times people, let me stand in front of Marcus so I'm not covering you. Now, many times people, when they get into this position, they shrug up the shoulders. This is the wrong way of doing it because you compress the joints in your neck here. We want to bring the shoulders down. In fact, actually push them down a little bit more, freeing up these muscles. The goal here is to strengthen the rhomboid muscles. You have the rhomboid minor up on top and the major down below. And the rhomboid muscles connect your shoulder blade to the spine. So when we strengthen these muscles, the neck is more stable because the upper back is the foundation for the neck. The good news about this exercise, when done properly, it not only strengthens the rhomboids, both of them, minor and major, but it also expands and stretches your pectoralis muscles in the front of the body. Now, if I can have you, Marcus, push your shoulders down, squeeze your shoulder blades together, squeezing this, you're contracting the rhomboids here, and at the same time, push out your chest, squeeze, push out your chest to stretch these muscles. And hold for 5 seconds or 3 seconds if it's too much, and then relax. Repeat this between 5 to 15 times, depending on what is good for you and what your healthcare provider may recommend. Now, the next one is the T exercises, similar in fashion. Now, palms towards the wall, Open your hands. Drop down the shoulders again. Squeeze and stretch. This does two things. It stretches the pec muscles, the chest muscles, opens them up really well, and at the same time contracts and fires the rest of the rhomboid, similar to the W position. You hold for 5 seconds, repeat 5 to 15 times, and then rest. And then last one, let him take a break. He's got big arms, so I'm sure holding it up is not easy. Now, we'll do the L exercises. Thumbs, perfect position. Shoulders down. Push them down. Squeeze. With this one, you are doing more for the rhomboids major down in here between the shoulder blades, and that squeeze, expansion of the chest, strengthens this muscle. You hold again for 5 seconds, repeat 10 to 15 times, and rest. Now, can I have you, Marcus, turn and face this side? Other exercises are isometric, meaning there's contraction, but no mobility, no movements. So first, we're going to do the flexors. So he's got his own hand against his forehead. He's going to push and resist with his own hand. Do not get someone else to push on you. It has to be your own hand. And then you hold that for 5 seconds. Repeat 5 to 10 times, 15 times if you're able to, and then relax. Now, drop your hand down. You repeat that again, 5 to 15 times, and then after that, we do the opposite. The muscles in the back, agonists and antagonists. We did it for the frontal muscles. Now we strengthen these. Interlocking. Can I have you turn? Interlocking the fingers at the back of the skull and tilting the head back, resisting with your own hands. Hold for 5 seconds. Now this may cause numbness or tingling, and if it does, you're not ready for this. After this, drop it down. Now if I can have you, face front. Now we're going to do the side muscles. Here, pressure this way, so you're forcing your head and neck there, but you're resisting any movement. Again, it should not be uncomfortable. Relax. It should not be painful. And if you have any numbness, any discomfort, you shouldn't do it. Hold time for this is 5 seconds. Repetitions between 5 to 15, depending on your needs and your condition. And then, of course, we want to do the same thing on the opposite side. Resist, hold 5 seconds, 3 seconds if you're unable to hold for 5 seconds, and rest. And these are the exercises. So aside from these, there are many other exercises that can be done, but they should only be done at a supervised setting, perhaps with your physiotherapist or with your chiropractic adjustments. But even these that I believe are safe, you should not do unless you consult your healthcare provider. I hope you found this helpful. And if you do, share it. If you have a comment, put it down. I promise to get back to you. And until we meet, stay blessed wherever you are. Good afternoon, good evening, and good morning. Thank you for joining me. I'm Yama Zafer. I'm a chiropractor, and I hope this helped.